reasons we wanted to have some of you come here is because the cancer journey, as one of my patients, Robert Percy, says, is you go into a bubble. Someone says you have cancer, and everything else is sort of resonating and is no longer making sense. And you're here, and everybody else is out there. And now you're the one who's suffering through these side effects, and you're the one who has to make these hard decisions, and you're the one who has to go through these tests. And it's almost like you've been removed from your world. And so when that happens, it's nice to meet people who've been in the bubble and come back out. And one of the things we were thinking for some of the patients is for them to meet people who confronted this and came through and survived and did well. So for those of you tonight who are just getting into this experience, we would very much like to introduce you to people who have been through it and who have come through this ordeal and come out the other side the better for the experience and stronger. And I think with a new appreciation of life. I was watching last night, I think my children had on TV the story of that Sully Sullenberger plane that a year ago, almost to the day, landed on the Hudson. And this woman said that she was an investment banker or something, and she said after that experience, she quit her job and became a volunteer for the Red Cross. And she just had this sort of new lease on her life. And there's a funny way that if you do come through this ordeal, you do get a kind of new appreciation of how precious and how miraculous our lives are. And I look at all these miracles. I mean, really, in the room tonight are miracles, real miracles. And it's not me so much as a technique that we've developed and we've worked diligently to apply, but it really is the miracle of the patients coming through this and surviving and coming out the other side. And so when I was asked to say anything at all tonight, I was thinking, well, why do I do this? Because my wife, who I forget to thank every time, so Maxine, I apologize once again. Thank you. Well, my wife always says to me, why can't you just be an oncologist? No way. No, I mean, because, you just go to work and you take Wednesdays off and you don't take all these very weekends. And I just can't. I just can't. It's because I did that. When I was a resident in medicine, why do I do this? I was a resident in medicine. I was really a good resident. I could get the arc line, and I could get the chest tube, and I could intubate, and I could save a life, and it was really great. And I got into my Georgetown Oncology Fellowship, and I just I didn't seem to be able to save my patients anymore. I couldn't seem to make people better. And I felt so deflated, and I felt so ineffectual, and I had sort of lost my mojo. I didn't have it anymore. I couldn't fix people anymore. And I ended around for my first 6 months of my oncology fellowship, and I was really suicidal. I hated it. And I got through my first year, and I moved into the laboratory to try to apply some work that a colleague and I had been doing here in California. And that's how I got involved in this, because it worked. Because I could find a leukemia patient who was failing therapy and study something in the laboratory and give them something that had just come out in the literature, and they got better. And I knew then that I had to do it that way. I couldn't just treat people by cookbook methodologies. I couldn't just administer therapies that came off some protocol or some standard therapy. And so the answer is why I can't just be an oncologist, because it doesn't work. It isn't good enough. And we have to be better. So Maxine, I'm sorry, because we don't have the luxuries that I might have if I just practice at home. But it's a luxury to have all the people like you in the audience. It's a real treat to be able to do this, and it is the reward. So I don't really need to be here talking about anything in particular, and I just wanted to say how delighted I am, but deeply delighted to have you all here so well and so fit and so successful. And I know that we don't win every battle, and sometimes we go back and fight them again and again. And some of the patients here are in the middle of it. We're not winning everything, but we're certainly trying. One of the things that kept me going in my fellowship was when I lost patients and felt so bad about it, personally bad, emotionally drained, I came to a realization that still drives me, and it is that even if I lose a fight, I know I was on the right side. Mm-hmm. Yeah. And that's what kept me going. Because when I lost a patient, as long as I knew that I did everything within my power, and as long as we applied everything within our grasp to make them better, then the loss was a loss that I couldn't have avoided. The ones that I don't want to lose are the ones that I could have avoided. And so, Maxine, the reason I do it is because I don't want to fail if I don't have to. And so I do this because that's the best thing I can do. And you're all examples of that. Every one of you. It's so amazing. Some of the stories here are astonishing, really miracles. So I'm delighted with you all. Couldn't be happier. And I'm not going to say anything else except thank you all for coming. Thank you all for surviving and for getting through all the terrible things I've done to you. For coming out and supporting us, and thank you in the future for letting people who might need this know about it. Because that's really what part of this tonight is about, is that you might meet people who have similar experiences and help other people in the future who might need to know about this. And so I think that's all I have to say. So thank you.